Hello, Dr. Mehrotra. Welcome back to the studios.
Thank you so much. It's great to be back.
It is, right? And it looks like, this show is becoming just more and more comfortable. People are listening in, people are, calling in with their questions. And we need to remind people that we are video recording this show and audio recording it, and it's on our page, which is MyWholeChild on Facebook. And if they do have any questions for us, they can email us at
drmehrotra1@gmail.com. So that's drmehrotra1@gmail.com. So we have a website, MyWholeChild.org, and a Facebook page where they can go ahead and post up their questions and concerns. And actually, it's sort of a community that we're trying to form so we can discuss and learn from each other.
Right, and the whole idea, like we keep mentioning, is so that we can actually have a conversation about integrative medicine, to have a 360-degree, point of view on it. And so, once again, to remind people, this is not a prescriptive show. It's a show to join the conversation. So please join our Facebook page, and come onto the website and let us know what you think about this. So we have a specific topic in mind for today.
Right. We'll be touching upon atopic dermatitis. That's a fancy name for eczema, which is more a common term that people may know.
Okay.
And eczema is another way of describing dry allergic skin.
Right. And so, as a mother, exactly, when people ask me, why are you with the doctor in the studio? I'm a mother of 2 kids. So I remember my son, when he was 1.5 years of age, he had dry skin behind his knees, and I remember calling you and you said, well, don't worry, it's called baby eczema and it'll go away. But while it was there was just nothing that I could apply to it or keep it away. I tried powder, I tried some kind of cream, and just as a parent, I was so petrified of using anything that had a steroid in it. So obviously, to me, I must have just been another paranoid mom. But really, if you were in my shoes, you're looking at a 1.5-year-old child who's got dry skin behind their knees. I mean, I don't even know where to begin finding solutions for it.
Right. So we actually, a little bit of misterm here. Baby eczema happens in the first few months of life. So this is eczema that...
Toddler eczema? I don't know, 1.5-year-old eczema? What do you call this?
So eczema, as you can see, can come at any age.
Yeah.
So as a baby, yes, you'll get it maybe starting at 4 to 6 weeks of age.
Right.
And then it may go away, or it may, it's characterized by aggravations, on and off, on and off.
Yeah.
And some of those kids will actually go on to keep eczema at a later age.
Okay.
So even that same eczema may continue till adulthood.
Right.
And really, it's not that much of a serious illness, but it's really
a
nuisance.
Illness.
Nuisance is what we call it.
Yeah, it's like a cold, I mean, think about it.
I think it's actually worse than a cold because it's there, it's unpredictable, it comes, it goes, it comes, it goes, it comes, it goes.
Yeah.
And when it comes, and if it comes back with a vengeance,
yeah,
then it's really irritating to the child.
And as an adult, it's also ugly, like there's certain dresses you can't wear. You don't want to be sitting in a meeting and scratching yourself. People might think you're contagious. I mean, I think there's a social aspect to it as well. And so how common is it?
It's actually quite common, and it comes on the spectrum of allergies. So usually, we had started talking about allergies in the last couple of weeks.
Yes.
So this is how we're continuing on into atopic dermatitis. So
atopic dermatitis.
Yeah, so you can tell it's a little cocktail type of a thing, you can say.
It's like saying champagne or regular sparkling wine.
So my child has atopic dermatitis, you can say.
Okay.
So characterized by dry, red, irritated skin, and this, as you rightly pointed out, the areas that it comes up are behind the knees. So we call them skin folds. So it can come in the So it comes in the inside the elbow region.
Yeah, behind your neck.
Behind the neck.
Okay.
It can come underneath in your armpits.
Okay.
It can come also anywhere on the body, so on your face, on your scalp.
Yeah.
But the characteristics are in the skin fold region as you get a little older.
So is there something, because there is a skin fold, that area is just more susceptible? Is that something to it?
Yeah, and I don't think anybody really knows why, but that is the reason that it's there in those regions. So that's what characterizes it. So when you come in with a rash and it's specifically localized to those areas, then that is one of the diagnostic criteria we use, saying, okay, this is eczema.
So is it like a first world problem, or is it like, is it a problem that's all over the world? Meaning, is that, sometimes people say, oh my God, you guys have no problem, so which is why you're worried about a little dry skin. But it's not true, right? This, I'm assuming it's prevalent across the world.
Right, so it is, we're now seeing it a lot more across the world. So
okay. And there are environmental factors that are triggering it, you think?
There are several trigger factors to it,
okay.
and we're still trying to identify more and more as time goes on. So one of the environmental
You're
factors
a physician, Dr. Malhotra. We've like walked the moon. We're supposed to find a cure for like
I wish
eczema.
It's one of those illnesses where we have some indications, but once again we don't have any absolutes. Kind of like cancer, you may say. Right, so I wouldn't equate the degree.
I would have gone to the common cold, but thank you for taking us to cancer.
It's just like, because there's so many types of, we just don't have exactly how to take care of it, how to cure it.
Okay.
We have ways of making it better.
Yeah.
We have some indications what aggravates it, so you can avoid those, what we call trigger factors.
Yeah.
So some of those trigger factors can be just a climate change.
Right.
So if the weather changes all of a sudden, it becomes really cold or it becomes really hot,
yeah.
that's when the eczema may flare up and the rash may come back.
So are you seeing more mothers like me who are coming in and saying, oh my God, this thing has a steroid, please don't give it to me. I don't want to put anything on my child. Even if my child is crying with pain.
Yes, well, obviously.
Or is it just me?
That's the treatment side of it, and we'll
right.
get into that in just a second. But the treatment, one of the hallmarks of the treatment are steroid-based creams.
Okay.
So we go ahead and use something like hydrocortisone,
yes.
and in different percentages. So there are some that are over the counter.
Okay.
So
you go from mild.
Go from mild, then to
okay.
moderate to severe as it's needed.
Okay.
So the mild ones you can go ahead and try
yeah.
For a few days, and if it doesn't get better, then we may go to the next one or to the next percentage.
So why are people petrified of something with steroids in it?
There are a lot of studies that are there where steroids are supposed to be really bad for your height, for your bones, for your eyes,
okay.
for lots of other long-term issues. But those steroids are the ones that you take.
Steroids have a bad rep.
They do.
Okay.
They're if you're taken by mouth,
okay.
so as a syrup or as a tablet for an extended period of time,
okay.
then those steroids can cause those long-term issues. But in a topical way, meaning that you're using it as a cream or an ointment for a few days, 5 to 7 days, usually they're not available.
I don't believe you. Come on. I mean, honestly, things get absorbed by the skin, right?
Sure.
So,
but the percentage that you're going to be using and the amount of absorption that happens through a topical ointment is minimal.
Is no reason for you to be paranoid.
Right.
Okay.
Because what it works locally, so it works right at the rash, and it takes care of those rash right there.
Okay. Okay. But I mean, tell me something. When you go to, what is that crazy word you use? Provider? What did you use last time?
Healthcare provider, yes.
Okay, healthcare provider. All right. See, I said it this time. But when you go to your doctor and the first thing, when the doctor is looking at, like, I don't know, 20 kids in a row, and you go in there as a paranoid parent and say, I have no idea why my child has, the skin issue because I've been applying all kinds of oil and cream and this and that. And sometimes I think as a parent, you, especially as a mother, you might take it personally. You might think it's a reflection of you not taking care of the child. In case you weren't aware, mothers do think like that. I thought like that. I was like, oh my God, this meant that he doesn't have good hygiene habits, and that's a reflection of me. But do you think that the doctor would actually sit with you and find out whether something has changed in the environment, or what is it that is actually causing it as a reaction, whether stress, or you think that the first thing they would do is like prescribe an ointment? What is the best way to have this discussion?
Well, the doctors should be doing the discussion. If they're not, then you need to probably find a different one.
Okay.
The thing is, we want to find out, first of all, make the right diagnosis.
Yeah.
So you want to look at the characteristics, how the rash is, and make the right diagnosis.
Yeah.
Then you want to look at what are called trigger factors. Trigger factors are things that aggravate the rash. So where does the rash flare up? Is it a certain food that causes that? Is it a certain stressor that causes your rash to flare up? Is it an environmental change that causes that?
Somebody's
Have you traveled?
Somebody else, yeah.
Right. So,
okay.
You might, a divorce that happens in the family. If it's an older child, that can really put a lot of stress on the child, and that can cause the rash to.
So stress is a trigger for eczema, or maybe?
Oh, sure.
Okay.
Stress is a trigger.
Okay.
So if your child is allergic to certain foods, so if you've eaten a certain type of food, then that can trigger off the rash. The climate change you went outside.
It's a complicated range of reasons.
It is, but actually once, and I think a lot of the parents get really very good with dealing with it. So they know, oh, all of a sudden it's going to be cold today and my eczema is going to flare up.
Okay.
Or my child's eczema is going to flare up.
Okay.
So they know, they can predict that.
Okay.
And I think moms are very, very good.
Or the other way around,
Or
actually.
the dads who are taking
Or the other way around. Oh, my son's eczema is flaring up. It might be cold today.
It's kind of like arthritis, right? In older seniors, they'll say, oh, I study, though maybe then, this is what's going to happen.
Great way to predict the weather.
Once they make that association, then you can be a little bit more proactive,
okay,
and you can take charge on how to avoid those aggravations.
Okay, okay. Now, as an adult, I recently remember, and I'm trying to think back whether it was stress. So much happens in a day. I don't think as an adult sometimes you have time to think about what is causing stress. But I remember I started having a little bit of dry skin on my arm, and I didn't think anything about it on my lower. What are the best ways does integrative medicine have an answer to this?
Sure, I think there are a lot of different approaches that people have taken, which have been shown to be beneficial.
Yeah.
So
you're not going to ask me to make my child meditate now, are you?
Well, since we know that stress can aggravate eczema, and you can try to de-stress.
Yeah. Have lots of bubble baths.
Well, that is not the right way, because
bubbles will cause the eczema.
Bubble baths can cause the eczema to aggravate.
You're not making this easy.
So the thing is, if it is stress that's been identified, and the child is a little bit older, where they can meditate, or do yoga or whatever else.
Kids don't meditate. It's difficult for them to sit still.
But then you need to teach them that. So those kids at that age can meditate.
Okay.
So
but meditate could be something as simple as just being still, right?
Just being still and trying to focus, and you can take the sound home and then just sort of focus on that sound.
Okay.
So it doesn't have to be anything where you're sitting in this dark room, but just trying to take that downtime out and sitting quietly and trying to focus, even for a few minutes.
What do you think that does? Why does it help?
I think it keeps the mind even. And it takes, we don't know exactly what hormones are being affected, but maybe your good hormones are being released on that.
Happy hormones.
So
that's one way to do it.
We definitely have seen homeopathy help with this. So I know a lot of our patients who've gone to India or who've been in touch with a homeopath, and they've taken a homeopathic remedy for this. Over the course of time, this has helped.
Now, homeopathic doesn't have any creams or something, right? I mean, it's all about taking...
Well, not necessarily. There are some homeopathic ointments that have been made that the homeopath may do, may conjure, and you can use those.
Right.
But you have to be cautious about who is taking that and where you're getting it from.
Right.
I've heard of reports where the homeopath actually was taking some steroid and mixing it into the ointment.
Okay.
And
so just because it looks natural
doesn't mean that it's actually. So when the parent right, so it's there are quacks out there as well. So you have to be careful.
We're not one of them.
So you have to be careful about where you're getting it from and who you're getting it from, because here is somebody who's using steroids and making it look like it's a homeopathic medicine.
Correct.
And the parent is very happy because now the rash is gone.
Correct.
But actually,
and the thing, they're doing it in the natural way.
Right. And typically when we tell you to use a steroid-based ointment on eczema, we want it to be about 5 to 7 days at a time. And homeopathic medicine works on a different concept where you take it for months and months and months.
So that can actually have a permanent side effect.
Right. Right. So those are the things that you have to watch out for, where you're getting that from and who you're getting it from.
Right. So it looks like a lot of it is based on trust. And I know as a parent, sometimes you hesitate to have, a discussion that you think, you just assume that your doctor is busy. You just assume that he doesn't have time. So it looks like there's a lot of onus on the parent as well, right? Me as a parent, I need to go in and say, you need to listen to me. I'm worried about this, right? I mean,
that is very true. And often what happens is, I usually try not to leave the room until I've asked the parent at least 3 times. Are you done with your question? Is there anything else you need to discuss before I go?
Right.
And even after that, once I walk into the hallway, parent comes back and asks me, oh doc, I forgot to ask you something.
Right, right.
So,
which is actually, you bring me to a really, really good point. It looks like, I remember I read this advice somewhere. I actually didn't do it, my bad. But it looks like when you do go and meet your doctor, you should actually, the day before, probably have it written down. Have 3 or 4 questions written down, because what might be worrying you the night before about your child, you might not remember when you're in this happy office, with birds flying, and the doctor looks at you and says, your kid looks great. You might not actually remember what happened.
And that's where I think your smartphone comes in. Every single parent of mine has notes all over the smartphone.
Really?
And they go through that, yes. So far that's, you know.
Wow, I need to learn from your parents. I don't use my smartphone. They really do?
They do.
Is that a checklist?
Yes, there's a checklist.
Is this a new trend that you're seeing, or parents were always like
this? That's a lot of the parents that I see, and that's what they do. Because they know that when they come in, I've told them many times that you need to make sure you write your questions down because you're going to forget.
Right.
And
especially when it's not something that's happened in the last 1 month, for example. You know, so eczema could have happened a month before,
right,
and you've forgotten about it.
Right.
Yeah.
Right. So you know, as we were getting back to the eczema, with the meditation, you can definitely do, and homeopathy, and then the allopathic treatment. So it's not just about steroids. I know you brought up steroids, but the first part of treatment is just putting a lot of emollients, meaning lots of lotions and creams.
Is that another fancy word for
it's
Vaseline?
Yes, or cocoa butter, or whatever you want to call coconut oil. A lot of parents use.
I'm assuming you're using all these fancy words on
because I want them to know.
So then when they go to the doctor and he says emollient or whatever, you'll say, okay, Vaseline is what you want me to buy. Okay.
Right. So any sort of a thick lotion can be applied,
Okay.
and that can be applied 3, 4, 5 times a day if needed. So that will help the soothing, and it'll actually moisturize, and it'll hopefully decrease the eczema. So if it's mild, that'll work.
Yeah.
The other thing that happens with the eczema is the itching. The itching is really severe. So a lot of these kids are not able to sleep through the night.
Yes.
And they keep...
Not to mention, they're going to, you know, it might bleed and you have sensitive skin.
Right. So, and then what happens, the other thing with that is as soon as you scratch, that nail of yours breaks open the skin even more.
Correct.
And your skin always has normal bacteria, and that bacteria gets under the skin and it gets infected. So that's when...
worse.
So that makes it much worse. So that...
What do you do? Tie them up like a mummy? What do you do?
In severe cases, I've had the parents do that.
Really?
Yes, and it's really sad to see these kids that way. Okay, so that is when those are severe cases. You'll have to go ahead and maybe even put them on oral steroids in that situation, because these kids are so bad, so bad, and trying to find out, you know, if the kid is really allergic to certain foods that are doing this. And then we start doing elimination diets. They may have to go to an allergist. They may have to find out exactly what to avoid.
So this sounds like life changes, actually. This sounds like a path where you realize what you have and then you handle it.
Then you have to handle it, right? So there's some kids who are on like very minimal type of foods. Their food variety is limited to maybe 3 or 4 things.
I'm sure
and they're allergic to everything else, and the growth of that child may be affected just because they're not able to eat the proper nutrition. So then they have to work with the nutrition. So this is a severe case of eczema. So it's a big spectrum. You can have very mild eczema, which can just be treated with some sort of emollients. You can have Vaseline, or you can have some mediums which can be treated with emollients plus steroids and avoidance of the trigger factors. And then in that situation, you can go ahead and use other integrative therapies. And then the severe cases, which are some of these kids who I feel really bad for, because they're just there scratching these 6-month, 9-month-old babies who are dressed up like a mummy because you have to keep their skin wrapped up. And those kids are really, really bad.
Is there a genetic element to eczema?
There is a genetic component to it. So if there's a family history of any sort of allergy, your child is more at risk.
Which is a new thing. I don't remember my parents ever getting tested for any kind of allergies. I have no idea if they're allergic to something or not, you know.
Yeah, but that's what we talked about even last time, is that allergies now are coming up more and more and more. So we need to be on top of that and really take charge of it and not be scared about it. And if we need to, just to make sure that our child is doing well, is to get those other therapies in there if need be.
So it looks like the lessons are, don't take it personally, you know, look at it, be honest with your doctor, have that relationship of trust, talk to him. Say if you're worried about something or concerned, and always remember that there are alternatives, right?
Sure.
Yes.
And if we didn't get to any of your concerns today, you're more than welcome to email at drmeherotra1@gmail.com. Or just calling us and being a part of the Facebook community.
And please be part of the Facebook community, because it's a conversation, and I think people will start doing things more when more people start questioning it and more people become part of the conversation.
And I think we need to learn from each other.
We need to learn from each other.